811. One more from this Howard Schultz on CNBC last night. He's running as an independent for president. It's awfully tough to do given all the ballot restrictions that exist. And, of course, the left-wing mob out there shouts him down, follows him around, you know, much like the Venezuelan types from Maduro do. But here he is again, making a point that Republicans should be making. Cut 4, go.
I believe that if I ran as a Democrat, I would have to say things that I know in my heart I do not believe, and I would have to be disingenuous. For example, what the progressive left-leaning Democratic Party is suggesting is government-paid health care for everyone, which is free, government job free for everyone, and government-paid college for everyone. I was a supporter and am a supporter of the Affordable Care Act, which I think can be improved and enhanced so that the premiums come down for families. But if you tally up those three programs over a 10-year period, it's approximately $40 trillion. And ladies and gentlemen, we are sitting right now with a national debt of $21.5 trillion on the balance sheet of our country. And if we were a company, if America was a company at $21.5 trillion of debt, adding $1 trillion a year, we would be facing insolvency.
No big deal, right? Here's what he's talking about. Here's Kamala Harris at a CNN town hall meeting last night. Cut 6, go.
What we know is that to live in a civil society, to be true to the ideals and the spirit of who we say we are as a country, we have to appreciate and understand that access to health care it should not be thought of as a privilege. It should be understood to be a right.
And you see, this is the phrase they've been using. She's not an original thinker. She's a regurgitator. By that I mean she just regurgitates what others have said. She doesn't have an independent, original thought in her head, and she hasn't voiced one yet. So health care is a right, not a privilege. So let me address it. How do you address it? Okay, I'm a vet, and I don't like the health care I'm getting. It's a right. Well, I have a right to pick the doctor I want. I have the right to get the medicines I need, and as soon as I need them, I have a right to get the specialists that I want, and so forth and so on. Now, ladies and gentlemen, if health care is a right for the vast majority of you, what does that mean? Obama said health care is a right, and he gave us Obamacare. So you don't have rights under Obamacare. What are your rights under Obamacare? Can you pick the doctor you want? Well, only if they're in the network. Can you pick the specialist you want? Only if they're in the network. Can I pick any plan I want? No. It's this one, or this one. Well, this one, and this one don't really cover what I need, and they're very expensive. Too bad. So how is that a right? And why can't Republicans respond to this stuff? Ask the American people, I would say. Ask the American people. With Obamacare, do they feel it's a right? Now that they're limited in the choice of doctors, now that their premiums have gone through the roof, now that it takes them forever to get cleared for a specialist, is that a right? Ask some of the people who have inferior veterans hospitals, and there's some good ones and there's some bad ones. Well, is that a right too? What does that mean, it's a right? Kamala Harris? So you've got to deal with their abstractive arguments with reality. And then you got to paint a picture of what could be too. Imagine if you could choose virtually whatever health care plan that you wanted. Imagine if you could choose a health care plan that you could afford. Imagine if you could choose a health care plan that didn't have coverages that you don't want. Imagine. Rather than 3 or 4 or 2 in some states 1, that you had 20, 25, or 30 choices. Imagine that you decide for your family what's best for your family. Imagine competition driving down costs. Why can't Republicans talk this way? Good Lord. Go ahead, Mr. Producer.
understood to be something that all people should be entitled to so that they can live a productive life, so they can have dignity.
What does that mean, all people should be entitled to health care? I'm quite serious about this. What does that mean? Well, I want to see that doctor over there, and I'm entitled to see that doctor. Well, you know, that doctor is an individual, too. That doctor has human rights, too. That doctor doesn't have to see everybody. No. Has to see me. Well, does the doctor have rights too? How about the nurses? Do they have rights too? How about the janitor in the hospital? Do they have rights too? How about the technicians in the hospital? Do they have rights too? Or are they indentured servants? I mean, what does this mean? That you're entitled? That you're entitled? Go ahead.
Having a system that makes a difference in terms of who receives what based on your income is unconscionable.
No. That's what insurance is for. That's why people have, in the past, and you really can't anymore, it's very limited, just got catastrophic health care. If I could, that's what I would do. Catastrophic health care. But that's limited or eliminated. It's not a matter of getting health care if you're wealthy. When you go in an emergency room, they don't ask you for your IRS returns. They don't ask you how much you're worth. Do they? No. If you need help, you get help in this country. If you need drugs and you can't afford them, pharmaceutical companies, if you can demonstrate it, give them to you for free or some de minimis cost. People who can't afford health care in this country, I'm not talking about most of you, where it's an incredibly difficult expense as a result of the further centralization of government and therefore health care. But people who are poor in this country, they're on Medicaid. People come into this country, set foot in this country, they know how to play the system and get Medicaid. You're paying for all that. And now they want you to pay for more. Who's going to pay for free college? Who's going to pay for all the debt that's owed to banks on student loans? Who's going to pay for free health care for all? What kind of insane party has the Democrat Party become? With this insane ideology, this Marxist ideology. It doesn't work. It never will work. But here's the kicker. Cut 7. Go.
To follow up on that, and correct me if I'm wrong, to reiterate, you support the Medicare for All bill, I think initially co-sponsored by Senator Bernie Sanders. You're also a co-sponsor on it. I believe.
Slow down, Jake. Slow down. You'll get your liberalism out in a moment. Go ahead.
Eliminate private insurance. So for people out there who like their insurance, they don't get to keep it?
Well, listen, the idea is that everyone gets access to medical care. And you don't have to go through the process of going through an insurance company, having them give you...
All right, whoa. You know the funny thing, Mr. Producer, when I want to get a license renewed or need something on my car, I don't have to go through an insurance company either. I have to get in this long line and get a number and stand there, sometimes for 50 minutes, 60 minutes, for the most minor task related to my automobile. There's no insurance company involved. Folks, those of you who actually pay taxes and have to have your income tax returns filled out, you do it or an accountant does it, there's no insurance company between you and the IRS. There's no insurance company between you and the federal government and all the regulations and rules. To open a restaurant, to maintain a restaurant, to get a cab, there's no insurance company between you and the government. And she makes it sound, well, get rid of the insurance companies and everything will be lovely because the government works so effectively. Since when? Where? Tell me where. Name one place. Post office is broke. Name one place. The EPA is out of control. Regulations up the wazoo. They're not customer friendly. They don't have to be. Actually, the post office has gotten pretty good. I'm talking about the rest of the federal government. The rest of the federal government. We'll get rid of the insurance. Have you ever dealt with the Social Security Administration? My father just passed away, as you know. Have you ever dealt with the Social Security Administration? It is a disaster. You've got vets who are fighting with the VA. Most of us don't have to fight with the VA. You ought to ask some of them what they have to go through. Again, some are good. It's hit and miss. How about your school? Let's take it to a local level. You have a complaint with your school. Boy, they're really customer friendly, aren't they? You can't decide which teacher your kid gets. The principal might be a jerk. The union runs the place. Oh, yeah, but there's no insurance company between you and them. You know, you get rid of the insurance companies and we'll get rid of all the paperwork and everything will be just swell. We get rid of the paperwork. Those of us who file taxes, isn't there a form telling the IRS that you have health care? Oh, yeah, there's a form. Even the IRS gets in on it. So let's stop playing games here. One of the reasons your doctor sits there with a laptop on his lap is because of Obamacare. Code number, what is it? Hemorrhoids? What is that again? 1H? I can't remember. Mary, Nurse Mary, what's hemorrhoids? The number. They're sitting there typing it in. They're servants of the government. They have to type it in. Go ahead.
The paperwork, all of the delay that may require. Who of us has not had that situation where you got to wait for approval?
And keep something in mind. She's been a local prosecutor, state attorney general, senator for 2 years, and she's got all the fixes. Ladies and gentlemen, this is just BS. I could do this. I could run for president and say, let me tell you something. We're going to have single payer. I'm going to get rid of all the paperwork. All the obstacles that are in front of you, we're going to get rid of that. We're going to make it much more efficient because it's a right. It's not a privilege, and it ought to be free. The rich ought to pay their way. The rich ought to pay their way. I mean, some guy has $50 million. What's he need with the other $20 million? He can live off $30 million. I'll take the $20 million. What's the big deal to him? Nothing. That's all. It's a right. You have a right. And the insurance companies are preventing you. With their obstructive paperwork, they're preventing you. They're stopping you. And while we're at it, college. College is a right. Education of our children, our young adult children, so they're better off in the country. That shouldn't depend on how much you have. You shouldn't have to go out and get a loan. Everybody should have access to free education. Absolutely. And if you took out a loan and you can't pay it, you shouldn't be burdened with that. Maybe you want to write poetry. Maybe you never know. Maybe you want to paint portraits. There are things you want to do. You shouldn't have to take a job that you don't want in order to pay back a loan. So the government will take over your loans. What else? What else do you want? We already have the food stamp program. We already have a heating program, an air conditioning program. We already have Medicaid. Here's what they really mean. Ready on the healthcare, Mr. Producer? It's not Medicare for all. It's Medicaid for all. You understand the difference? We're all going to be on welfare. We're all going to get the lowest of the low kind of medical coverage, treatment, I should say. Innovations are going to go away, whether in medical care, technology, pharmaceutical, all go away. All go away. If this really works, why hasn't it worked anywhere else? Well, Britain, go ahead and use their health care service. Go ahead. Nobody likes their health care service. The people there, they do now because they don't know any better. That's where they are. I love my health care system. And he's talking and his tooth falls right out. I'll be right back.
Mark Levin.